so many people living with diabetes. I am one of them. The purpose of my speech today is to give you information about diabetes and the different types of diabetes. I was diagnosed with this disease 2 weeks ago. I researched the information on the internet and I read the pamphlets that I received at the doctor's office on my last visit. There is something in the world that people are crazy for. It's something that they just cannot live without. And they always want more and more and more of it. That's the sweet taste of sugar. Although the sweet taste that everyone loves can't be devoured by every person. The people that I am speaking about is people that are diabetics. Some diabetics can't have any sugar. If they can have some, it's very little. Imagine what you would do if you had to watch everything that you eat. That's what diabetics have to do to survive. I'm going to tell you about the different types of diabetics and how diabetes takes care of themselves and about the future of diabetics. The number one thing that you need to know about diabetes is that there is two main types. The first type is called type 1 diabetes. Type 1 diabetics is also known as juvenile diabetics because the onset of this type usually only happens to younger people such as children, teenagers, and young adults. Although there have been causes where adults have been diagnosed with type 1 diabetes. This type of diabetes happens when the beta cell in the pancreas stops producing insulin. Insulin is what the body produces to turn food into energy. Only 5% of people with diabetes have this form of the disease. With the help of insulin, therapy, and other treatments, even young children with type 1 diabetes can live and learn and manage their condition and live long, healthier, and happier lives. Through multiple daily injections with insulin pens or syringe or an insulin pump, it will be up to you to monitor your blood glucose levels and appropriately administer your insulin. The other type of diabetics is type 2 diabetics. Type 2 diabetics is generally called adult onset. This is what I suffer from. Type 2 diabetes or non-insulin dependent diabetes. This is the most common type of diabetes. People of any age can develop the forms of type 2 diabetes. Lots of people have this form of diabetes without being formally diagnosed with it. Type 2 diabetes, the pancreas loses the ability to create enough insulin for the amount of food you're eating. Insulin is important because it acts like a key to open most cells and let sugar from your bloodstream move inside. Sugar, also known as glucose, gives your body energy. Without the right amount of working insulin, sugar increases in your blood and isn't turned into energy in most cells. Too much sugar in your blood can damage your blood vessels. Left untreated, high blood sugars can lead to complications in your eyes, gums, feet, nerves, and kidneys, and increase your risk of heart attacks and strokes. Some common signs are urinating more frequently, thirsty than usual, bluer vision, feeling tired all the time, cuts and bruises that heal very slowly, tingling or numbness in your hands or feet, weight loss, and frequent infections. Common signs of low blood sugar, feeling confused, headaches, tingling sensation around your mouth, pale skin color, sweaty, dry, itchy skin, and feeling down or sad. While you can't cure diabetes, Your doctor can help you develop a treatment plan so you feel better and stay healthier. Healthy eating, exercising, and weight loss might be enough to control your blood sugar. But if these steps aren't enough, then you may need medicine or insulin to help keep your blood sugar under control. Non-insulin medicines, these are an option if your pancreas can still make more insulin or allow insulin in your body to work better or decrease the amount of sugar your liver makes. Insulin medicine, if your pancreas can no longer make insulin, then the doctor may suggest adding insulin. Insulin cannot be taken by mouth because normal digestion interferes with how it works. You'll have to inject it with a syringe and a needle, pen, or pump. There are fast and long-acting options. Your doctor will help you find out which type of amount is right for you. In closing, it's not easy to hear that you have been diagnosed with diabetes. The first step towards to feeling better and living a longer and healthier life. Your healthcare team depends on you to talk to them honestly and tell them how you're feeling. Just remember, diabetes can affect your entire body if not treated. High blood sugars especially put the health of your smallest blood vessel and nerves at risk. This can lead to complications for your heart, eyes, feet, kidneys, and more than that. Your doctor can help you take steps to help manage and help prevent complications. Thank you.